Welcome everyone to a podcast by the Conservative Mental Health Group that aims to open up conversations about mental health within the Conservative Party. And in episode 2, I speak with two fantastic guests who have had significant impact on mental health within the Conservative Party, something that's been a positive impact, I have to say, not least due to their organisation and participation in a very notable debate in 2012, which we'll come to shortly. But just to do introductions, we have Baroness Morgan, former MP for Loughborough. She's also held senior roles in government as a Minister of State for Women and Equalities, a Secretary of State for Education, and a Secretary of State for Digital, Culture, Media and Sport. And we have Sir Charles Walker, a former MP for Broxbourne, and who's also been chairman of numerous committees, not least the 1922 committee. So welcome to the show, both of you, and thank you for coming on.
Thank you for inviting us.
Thank you.
Perfect. So I want to start by taking you back to the 14th of June 2012, where an important debate on mental health occurred, something both of you fought quite hard, actually, to put on the floor of the House of Commons. And just to start with you, Nicky, why did you think a debate on mental health was important, and why specifically to take place in the House of Commons instead of Westminster Hall, which usually it would be shelved to?
Well, thank you so much for the invitation to be here this morning and for the recording. I think that we wanted it to be on the floor of the main House of Commons chamber, and we wanted it to be a general debate on mental health. There hadn't been one of those for a number of years. Charles, I think I'm right in saying that I think you were chairing the APPG for mental health at the time. And I'd come in, so it was just over 2 years after I'd been first elected in 2010, and mental health was one of the areas that I really wanted to focus on. I think we felt at the time that, and I think, fun enough, I've reread the Hansard of the debate, and we felt that mental health was very much a Cinderella service in the NHS. It didn't get the attention that it deserved and needed. There was beginning to be talk about parity of esteem, but I think it was quite symbolic for the whole issue of mental health, and we wanted it to be debated in a sort of a holistic sense, basically, for MPs to be able to raise really whatever they wanted, whether it was their own experiences, which I'm sure we'll come to, or constituency experiences, or areas of policy. And for that not to be sort of somehow shunted off to the House, the Commons second chamber with Westminster Hall, which, as you say, is a great place. But I think having it on the floor of the House, we had a whole afternoon debated to it, and it was I think the Backbench Business Committee was a relatively new innovation at that point, and so MPs were able to go and ask for business to be debated, and we had secured this debate. So it was a really special moment, actually, and I think remains one of the things I'm most proud of having done in my 9.5 years in the Commons.
Yeah, absolutely. Well, it was obviously a really, really special moment, not least because MPs opened up about their own experience on the floor of the House of Commons, which I can tell you as a 13-year-old Dan who's watching, that was pretty inspiring to see. And Charles, it was a particularly important debate for you in that regard, wasn't it? Because you opened up about your struggles with OCD. I mean, what was that like on the floor of the House of Commons, standing up in front of your colleagues and opening up about that?
Gosh, it was a long time ago. I remember having a discussion with my wife, should I do it? And she was just slightly reticent, but in the end she said, go ahead. And I look back at it, because this is sort of an honesty session, and I do wonder if I made the right decision. I still wonder about it. I worry about the chamber sort of turning into a confessional, but I did try to do it with a lightness of touch. It's part of who I am. It shaped me. At times it's been a pain, but there is humor in it. And in saying that, I don't want to compare my OCD with, say, a lifetime diagnosis of psychosis, schizophrenia, or severe depression. The two are not comparable. They may be mental health illnesses, but we don't do it in physical health. We don't say sort of a broken leg is as severe as stage 4 cancer, and we need to guard against doing that in mental health. But I want to pay tribute to Nicky. She was a relatively new member of Parliament. She'd been there for 2 years, and I think it was a pretty seminal moment in the chamber. But the really important thing, it also, didn't it, Nicky, paved the way for the Mental Health Discrimination Act.
Yeah. Yes.
Which, as Nicky knows, Gavin Barwell brought in with Lord Stevenson in the Lords. It was his idea, which sort of took away the discriminations about being company director, school governor, serving on juries. And I think that was a really important thing. And it was Nicky's debate that paved the way for that.
Yeah, absolutely. And obviously, Charles, I remember when you did the speech, you said, I think you said, I've been a practicing fruitcake for 31 years. I think that's how the introduction started. So it really put people at ease, I think, when you were talking about that. And I liked how you definitely said how you were like character in Riverdance when dancing between rooms. I'm sure I can definitely relate to that.
I remember talking about the endless taps in the House of Commons when you go to the House of Commons bathrooms and you have to, oh my God, endless hand washing, which I have to say, when we get into COVID, there was no problems there with COVID and hand washing.
Absolutely. I can imagine it came in use. And before we move on to the kind of Mental Health Discrimination Act, the kind of Gavin Barwell kind of brought through, just back to you, Charles, as well. I mean, in some interviews, you've described OCD as a gift. And I was really curious about that, because, as someone who's experienced OCD myself, it can have many benefits as well as actually limitations as well. I mean, can you go into that a little bit?
Well, I think it gives you enormous resilience because it is a difficult thing to deal with on a day-to-day basis. As you will know, Danny, there are periods when it's extremely active. That's normally around a significant change in your life. And there are periods when it's more in abeyance. But I think it's made, as I've got older, it has made me more resilient, perhaps more humane in my dealings with people. Would I have liked to have had a life without it? I suspect I would. I think it might have been a slightly different life, but you've got to live with the hand you're dealt with. And actually, as much as the bad and the unhappiness that it has caused through periods of my life, actually, I think as a human being, and I'm not perfect, I'm very flawed, but as a human being, it's probably made me a better person.
Absolutely, completely agree. And obviously linked to all of this, the fact that we're having this conversation is things like the Mental Health Discrimination Act, which Gavin Barwell brought through. I mean, how significant was that, Nicky, to actually have an act that changed the law in a way that allowed people who'd been sectioned to be school governors, to be a member of Parliament? I think you weren't able to be a member of Parliament even at that point. What was that like, and how much of an impact do you think it had?
I think it had enormous impact, and I think it just shows the power of being in Parliament, and it's why so many people still want to stand as members of the House of Commons, or to become members of the House of Lords, because actually that's where you change the law, and you can change. It's not just the legal words on the page. It's then the attitudes that go with it, and I think that's why the Act was really important. And again, reading the record of the debate, I think both front benches pledged cross-party support for that private members bill. And I think anyone who knows anything about parliamentary procedure knows that actually getting a private members bill from, an idea and words on a page to actually being passed as an act of parliament is no mean feat. But again, it's where backbench MPs often make the biggest difference, and I say that having been a minister, and Gavin went on to be a minister, but I suspect he went on to be Theresa May's chief of staff, and yet I suspect if you interviewed him, he'd probably still say that was one of the biggest things that he did when he was in Parliament. And I think what the debate, we wanted to do, but I think then leading on, hopefully, to just people being able to talk more about their mental health struggles. And of course, the other thing about the debate is, we had MPs like Charles who talked about their own struggles. There are people like you, Danny, watching who themselves are going through it. But don't forget, people, mental health affects, or poor mental health affects a lot of people around as well. So family members, work colleagues, promoting better understanding, for example, in the NHS. And so an act like Gavin's really helped in terms of challenging that stigma and discrimination. And again, reading the Hansard, we talked a lot at that time about stigma. And I think I'm sure there still is a reluctance amongst some people. It's a very difficult thing to talk to an employer about, or to in a new relationship, to talk to somebody else about it. But I would like to think that over the course of the last decade, the stigma around, mental ill health has definitely lessened. But of course, it's still there.
Absolutely. I mean, this kind of leads on to what was the broader impact of the debate? Because it seemed that after that point, I mean, you just need to look at when Theresa May came in, where she stood on the steps of Downing Street and identified mental health as one of the evils within our society, that people weren't getting the support they need. I mean, what impact do you think the debate had on the next 8 years? Because obviously there was a certain period that we're going to discuss in a second that kind of interrupted that. But in 8 years, what impact do you think it had?
Well, I do think it meant, as I say, that we talked about mental health a lot more, I think, in Parliament. And I think, it's interesting what Charles said at the beginning about, and I think he's right, which is you don't want the House of Commons chamber to be a confessional, because you're there to represent constituents as much as, but MPs do bring their own experiences. Of course they do. And I do think that actually it was important that, people who are in public life, who are deemed to be significant figures, do talk about their own experiences, because I think that does resonate. And there will have been people, and whether it was you included, Danny, but maybe other members of the Conservative Mental Health Group, who might have thought that actually battling with their own mental health was a reason for not standing for Parliament. And I hope that they would go, well, actually, perhaps that's a reason I should stand for Parliament, or there's no bar. And I think that, we had the Health and Social Care Act, which was a controversial reform, and successive governments have now been undoing it. But I think that actually that parity of esteem, writing in, Jeremy Hunt was always very committed to parity of esteem for mental health. And I think we've got the NHS, the sort of the constitution, and mental health parity of esteem was written into that. And so I'd like to think, as I say, that it began to change the conversation, and also gave encouragement to people outside the House of Commons, working in, right the way across health services, charities, voluntary services, local authorities, that again, this was an area whose time had come in terms of national attention.
Absolutely. And just to jump on that, Charles, do you think we achieved parity of esteem?
Well, Danny, do you remember, wasn't there a health and social care bill in 23 or 23 where they left it out? You're the academic, you're doing a PhD on this, but they left it out. And we asked, why have you left it? Oh, because it's happened. We don't need to mention it anymore. And it just makes me smile, Nicky, talking about Theresa May, because Theresa May got on the case. And you will find a debate with Ed Arger saying, no, it's definitely back in now. So, and I think that flowed from Nicky's debate. I remember in 2012, Nicky telling me she'd secured this debate in the main chamber, which is like playing at Lords. And Nicky will know the main chamber is like playing at Lords. Westminster Hall, with all its merits, is like netting at Lords. You want to be on the central square. But it was extraordinary. When there was this slight backpedaling on parity of esteem, Theresa May was right in there. We had calls with civil servants, and one civil servant said, but public policy is about choices. And I remember Theresa May roaring and saying, I might just be aware of that, funnily enough. And I think once that exchange had happened, it was always coming back in.
Yeah, absolutely. A lot of people will say around kind of parity of esteem that it's an unfinished business, really, in the sense that we did have large levels of investment go into mental health services. We did have what we're going to move on to in a second, school support be introduced. Talking about reforming the Mental Health Act, 1983. All of these things started under the Conservatives. But I guess it does feel to a lot of people I speak to that mental health has somewhat been forgotten, or somewhere along the way it has been forgotten. Do you feel, is that your experience, or do you think it's still a kind of a prominent issue still within the Conservative Party and more broadly with the government at large?
Well, I'm not sure necessarily about within the Conservative Party, in the sense that I just think there's an awful lot going on. And I think probably it's incumbent on, those of us who are interested in this subject, groups like the Conservative Mental Health Group, those of you who want to be candidates at the next election, whether that's or local government, national government, to keep making the case. I mean, the Conservative Party is going to have lots of policy reviews. They're going to be thinking about policy manifesto commitments the next election in due course, and making sure that's talked about. I think, all right, so in some ways, it's become sort of, we did talk about mental health a lot. And then I think, as Charles says, the fact that you're then able to have Department of Health officials presumably saying, oh, well, we don't need to talk about it specifically, just shows in some ways that's a success. But I think, as we know, in a way, it's a bit like, what gets measured gets done. What gets talked about gets focused on. And I think when things slip out of public consciousness, particularly in Parliament or across Whitehall, then inevitably it slips. So that's why it's important that everybody continues to talk about this. I think what's really interesting is now you're beginning to see as well, and we'll come on to talk about it perhaps a little bit, the young people in schools, that and where people are so aware of mental health, that actually it's become, we've seen in the last couple of months this debate now about, well, maybe we're overdiagnosing. Maybe actually there is this thing. And I think, I remember taking this from one of Charles's APPG meetings. Somebody there said, everybody has mental health. It's just that some people's is better than others. And, there is this thing about whether when people talking about mental health, they're really talking about resilience in some cases. And there are other ways of supporting people. But of course, there are always going to be people with serious mental health conditions who are going to need that support. And I do welcome, I think the current government has talked about having specific mental health sort of first aid places, so people can be triaged, because we know there are too many people still going to A&E departments, with a mental health crisis, and that is not the right place for them to be. So there are better places, and if we can continue to look after people better, improve that care, that's got to be a good thing.
Yeah, absolutely. Would you agree with that, Charles?
No, I would. I think as far as everybody does have mental health, and that's really important. We all have physical health. We all have mental health, and we have to build resilience. Life doesn't always go our way, and we mustn't medicalize normal human emotions. It is absolutely reasonable to feel sad when somebody you love dies, or to feel ashamed and embarrassed and frightened when you get caught doing something stupid. And we mustn't diagnose that as a mental health problem. That is a normal human reaction. I also think that the mental health charities need to sort of move to the next level. I think they've overplayed. It used to be 1 in 5, then it was 1 in 4. Look, there's a whole spectrum of mental health, right from lifetime conditions that shorten your life by, on average, 10 years or more, psychosis, schizophrenia, down to having a short episode of depression, which is transitory and never comes back again. And we've got to understand that there's that spectrum.
Absolutely. And this is definitely something that, as Nicky alluded to as well, has come up time and time again over the last. We've had, I think, Labour say it, the Conservatives say it. I think even Reform has said it too. So this is kind of obviously a big thing that's comes up. But just to go back to Nicky, obviously I want to talk about the work that you did in education, because as a young person growing up with a mental health problem, it is not easy. And I know within the education system, sometimes it leaves you excluded. A lot of the time it can feel, like there's nowhere to go and things like that. So, but you started the ball rolling on this and actually making sure that schools played a stronger role in mental health intervention. Why did you think it was important for schools to kind of come into the fold? And it's kind of attached more to your kind of holistic approach as well. Why did you think that was so important?
Well, look, I think when you're growing up, you spend 13 years at least in the school system, and so the teacher's observation of pupils and support if they spot a problem. And undoubtedly, a lot of this around health generally is you want to sort of focus on health prevention. There are, of course, cases where people generally, young people in particular, appear to be fine and they have a very serious episode of poor mental health. But I think for other people, Charles talked about the spectrum, many people will start with something and potentially if they get support support early enough and the right support, then actually they're able to prevent there being a more serious episode of mental ill health later on. And so my view was that schools absolutely have a role in that. Look, one of the great things about being Education Secretary is you get to visit many different schools and have many of those frontline conversations. And I would get that from schools, and they would say, well, look, we're trying to do all this, but we're finding it really difficult to liaise with the NHS, for example, or the local mental health system. I think we still know, Charles Owen just stopped being a member of Parliament, and I bet he had constituency cases right up until the end about families struggling to access child and adolescent mental health services. We know that they are under pressure across the country. And so, and we also know that sadly, perhaps, each school having its own school nurse is a thing of the past, for example. But I think that joint working between schools and local health services, and I mentioned Jeremy Hunt earlier on, and I have to say, actually, one of the things that when you're a minister, your officials, Department for Education officials were very keen on the fact that the department had a role in young people's mental health services. But, schools have got lots of things to do. And it was, yes, we'd like to do more on this, but not sure. And they were talking to officials, everything else. And then, I think I just spoke to Jeremy about it. And from that moment, we were like, no, we should work on this jointly. And it's one of the things about Whitehall departments can be very siloed. But actually, once we said we wanted to work on it, then officials really, sort of started working on it. But you're right, the broader holistic point was the other thing I focused on, and Charles has mentioned the resilience word. I mean, I did a lot of work when I was in education on what we call character education. Now, again, there's no substitute. Somebody has a serious mental health condition, they will need proper support. But I do think there are lots of things that we can do to build young people's self-confidence and resilience and preparation, frankly, for the pressures of modern life. And that is also something that schools very much have a role. I think schools do this anyway, and the best schools do it really, really well. And I wanted to see it just happen right the way across the system.
Absolutely. Did you receive any pushback from obviously trying to introduce mental health in schools? Because I know teachers were a little bit concerned that they didn't feel equipped to provide that sort of support to their students.
Yeah, I mean, yes, I did, and I think there's always a worry, and I think partly it is, you say, they're teachers, they're not mental health experts, and I think mental health is also one of those things that people are a little bit wary of, doing the wrong thing or saying the wrong thing and setting somebody off on a path of feeling even worse about themselves, and I think also probably a lot of the time when teachers might spot something and want to raise it with families, then again, a lot of families, because they haven't had experience of mental health, will say, no, I'm sure it's nothing. It's just something's going on and everything else. So I think there's a worry about that. And that's why it's like joint working, whether it's with, local health services, local GPs, spotting that support, getting referrals earlier on, is so important. It's not saying that schools themselves have to deal with mental health, although I suspect these days that many of them do feel that they need to do that. But it's how can we get you the right contacts to be able to refer into the system as quickly as possible. That was what we were thinking.
Absolutely, and it did make a massive difference, and obviously it led to school support teams and trying to build that broader connection with the NHS as well. And it's that sort of what's interesting when you look at this, because I've had the terrible task of going through all Hansard debates on mental health, including the 2012 one, which I think I've coded about 20 times now. So, but going through, and you can see that natural progression from the sort of worries about risk all the way through to this kind of opening up about stigma, to this holistic era that you speak about, which is really fascinating to see. And I think you're definitely pivotal in actually doing that there. But what happens when government slightly goes into crisis mode? That's where I'm kind of moving to now, where, we had this massive change on mental health, moving to holistic, joined up thinking, and then government couldn't feel less joined up when we arrived at the pandemic. And Charles, what impact do you think the pandemic had on everyone's, but specifically young people's mental health?
You'd expect me to say this, and I say it whenever I'm asked a question. I think it was devastating for young people. I think they were pretty brushed aside. I was a critic of the way we dealt with COVID. I would have had the first lockdown, but once we understood who was most vulnerable, I would have had a more targeted approach. We talked about this before going on air. I have a daughter who's a primary school teacher, and she's dealing with a whole cohort, 3 cohorts of children over 3 years who are unregulated in their behaviours, have behavioural issues. And this is going to be a barrage that goes through the school system. And as American academics have said, it's going to end up probably in our prisons. I thought COVID blew any idea of parity of esteem out of the water. Myself and Theresa May were very interested in having someone on the roster with the Prime Minister who was the champion and the lead for mental health. We were told that was Chris Whitty. That didn't go down too well with myself and the former Prime Minister, because we felt that had come as news to us, given how he was conducting himself on the roster.
Absolutely. And obviously, what could we have done better to support people during the pandemic? I mean, like I said, before we went on now, I was telling you about, when I was an undergrad, I worked at a kind of mental health kind of halfway house, and actually seeing the impact it had on a lot of those young people was really devastating to see. But what could we have done better to also kind of protect people, but at the same accord, also support mental health? Because like you said, it didn't seem to really get a look in during the pandemic.
I mean, this virus posed virtually no risk to young people, virtually no risk. And that should have been recognised. Now, I believe that most people, if allowed to, make good and strong decisions. And I think people would have behaved responsibly. But we didn't allow them the opportunity to do that. So we put youngsters in university halls into lockdown. We handed out fines when they broke the restrictive rules. It wasn't our finest hour. And I hope this COVID inquiry, instead of trying to lay blame or come up with the cliche that we should have locked down earlier, actually explores whether the measures we took were ultimately proportionate, and whether where they might have been absolutely to the advantage of some, they were to the absolute disadvantage of others.
Yeah, absolutely. Would you agree with that, Nicky?
I would agree with that, and I think that one of the things that COVID showed us in the pandemic is we are social beings, and I think particularly for young people. I sat on a House of Lords inquiry into to COVID-19. It probably went a bit too early in a way, because I think we are still, and will, as Charles says, continue to see particularly the impact on young people. I mean, I know we're talking about that. I would just say, I think for older people who were very isolated, and when I say older, I mean, probably, I'm talking Charles and my age, but, people, we had friends, I'm sure, who were shielding and everything else. And that was tough. But he's absolutely right. Young people bore the brunt of keeping older people, more vulnerable, safe. And I think that socialisation aspect, right away from, young children now arriving at school, who don't have the social skills that they would expect, people whose university experiences were, very, very different than what they had an absolute right to expect. I know I had a secondary school son who just started secondary school when the pandemic struck, and undoubtedly, I think for his generation, it has taken much longer to learn to be social, to be outgoing, to get back into the swing of school. And I think the other thing is that, they were encouraged, we all were to a certain extent, but they were encouraged to live life online. And one of the things we haven't touched on at all, and one of the great changes since the 2012 debate, of course, is the whole advent of social media, life online, and the pressure that brings to young people. And for a couple of years, basically, we asked them to do nothing but live online. So we shouldn't really be surprised by, some of the damage that has undoubtedly wrought to them.
Yeah, absolutely. And yeah, we probably should have touched on that. I mean, that's an interesting area, social media, and obviously connecting it to the pandemic. I mean, what can we do to actually address that? Because we had the Internet Harms Bill that got brought through Parliament. A lot of people were somewhat sceptical of that. They didn't think it went far enough. I mean, what more can we do with these international kind of companies, the international online things that have no general base? I mean, how can we address a lot of the problems online?
Well, I mean, I was very involved in the Online Safety Act. It's a starting point, and I think that the tech companies are enormous. They're now going to have to do more risk assessments and everything else. And I think that's obviously that's part of it. But I think the other point, we talked about prevention earlier on, and I think many schools, as well as families as well. But I think obviously because of the exposure of young people, schools and lessons and everything else, and PSHE was already in the school curriculum. There are many more lessons now about how to stay safe online, but more importantly, actually, how to stay resilient in the face of the endless Instagram posts of so-called perfect people living perfect lives, or of course it being mecca for bullying in a way that when Charles and I were growing up, even probably to a certain extent, you, Danny, actually you were able to leave school, and if you were in a situation where you had people who were making life difficult, you could leave them at the school gate. Now, of course, they're in people's phones and they're online and everything else. So how do you teach young people to be resilient, not to do the doom scrolling and everything else? And I think just talking about that more, one of the big things we talked about in the House of Lords a lot is the Jonathan Haidt book, the anxious sort of generation anxiety caused by social media. And I think we are now a lot more alive to that. And if you do a polling of young people, they will say now that they really wish that they spent less time online. So we need to help them. We need to talk about that. And so in a way, if you're rerunning the debate now, 13 years later, and it's the anniversary, I think it's the end of this week, isn't it, really? You couldn't have this debate without talking, I think, about the impact of social media and as I say, the internet on people's mental health.
Absolutely. And I think also it's just one of these things that's so hard when you've got these obviously big companies, and trying to kind of regulate them is so hard. So I think the second part around prevention is really, really important to make sure young people have got the skills they need. Now, to combine all of that together, you've both had very prominent roles in public life. Public life is not always the kindest of places. I mean, what would you say would be your advice to anybody wanting to go into public life, and how to deal with a lot of the pressures that come with that kind of existence?
And go on social media.
Don't go on.
Yeah, don't go. Well, yeah, that's. I think one of the things when I'm asked this question, I would say don't go into public life too young. I think you need to know who you are, and have your own to build your own self-confidence as well. I think it's really important that you have people around you who know you well, and who know you for not being an MP or a candidate, whether that's family. I don't know what Charles's wife was like. My husband definitely took it upon himself to make sure that I never got too big for my boots. So I was reminded that there's more to life than politics, and he's quite political himself. But there's more out there. Retain a group of friends who are nothing to do with politics, who really don't care. That's really, really important. And I think the other thing is, think about how you are going to deal with stress and pressure. Lots of jobs are pressured and stressful, not just being obviously a member of parliament. In my case, it was things like running, which I was definitely a saviour for my mental health at times. And doing things like not turning to, the House of Commons is full of bars. The opportunity to have a drink is ever present. Try to lead a relatively healthy life. Get enough sleep. It's really basic things like that I think stand you in good stead. And you're right in a way, Danny, which is thinking about it. Try to think about it before you end up in a spiral, basically.
Absolutely. And I would definitely agree with the running part. I go for a run every single morning, which I find absolutely useful. I'm not sure about doing ultra marathons like that event we had in a thing. That might be only once in a generation. Would you agree, Charles, with all of that? I mean, you've already talked about not really drinking in the House of Commons.
Yeah, no, I certainly would. But I think the public will end up with the politicians they deserve. And this is a really important conversation to have, because, if you make being a member of parliament as unpleasant as you can possibly make it for those doing it, good, decent, well-adjusted people will pull themselves out of the recruitment pool. and they will be replaced by the type of person the public really don't want. And finally, the public will actually be right when they say you're only in it for yourselves, because they will be the only people who are willing to do it, sort of show business. And it really worries me. It is very, very unpleasant, and it got more and more unpleasant as we got in 2005. I stayed till 2024. My seat was held at the general election. I just had enough. And I was told you've got to have a rhino skin. You don't want politicians with rhino skins. You want them to feel stuff. And I think the public are our employers. And if you want to be a good employer, yes, of course we should be held up to scrutiny. Of course we should be challenged. But actually, in my time there, 2 of my colleagues were murdered. Many of my colleagues, you never hear about it, ended up with people who'd made their lives miserable going to prison. And we weren't allowed to talk about it because it encouraged others. Female colleagues, and I'm afraid Nicky's true, had it even worse than male colleagues. And if you were a female colleague who was black or Asian, you had it even worse. And we cannot avoid talking about the fact that for many people, it is an utterly miserable existence. Yeah. And I'm sorry, but
I think
that's my takeout.
I think you're right, and it's difficult because you don't want to talk about it too much because you don't want to put good people off. I mean, Charles is exactly right. But I think you have to realise that, absolutely, there are many different pressures, and we do lose good people along the way, and that I think is a real shame for the country, for the electorate, and for our democracy.
Yeah, absolutely. And I think anyone wanting to go into public life, or at least what I've kind of studied and seen, I sound like a right academic, I've studied and seen, but generally that you do need that kind of foundation. You do need to kind of prepare yourself for what you're getting into and make sure that you are getting into it, as Charles said, for the right reasons, that you still feel able and have the energy to want to make a difference and to do whatever you can to do. Because as both of you definitely know, can be quite slow making a difference sometimes in the House of Commons. Okay, well, just to finish off, I just want to say a massive thank you to both of you for giving so much of your time to this podcast. It is a real pleasure, and thank you for everything you've done for mental health as well.
Thank you.
Thank you very much. And thank you to you, Danny, and to the Conservative Mental Health Group for everything that you're doing. And, keep fighting as the party does its policy reviews to make sure mental health gets its rightful place in the attention.
Oh, absolutely. We keep going. We keep harassing.
And Danny, could I just close with one thing? Can our party remember the sacrifices that youngsters made? So can they stop campaigning against building houses for them to live in? Can we actually have an offer that says thank you to young men and women?
Yes.
All the sacrifices they made for us middle-aged people living in nice houses with gardens. I mean, the Conservative Party, this is a political podcast, has got to get real and actually have an offer for youngsters that makes us attractive again.
Absolutely, and I would love to own my own home one day. So
I want you to own your own home.
I thank you very much, Charles. I really appreciate that. I'll get there eventually, and policy will follow, I'm sure. Thank you very much to both of you.